Let's see. My heart beats irregular and beats too fast.
She had her first open heart at 8 months old, and she ended up having a pacemaker implanted when she was 5.
Have you ever had a snare patch before?
Yeah.
She ended up getting a new pacemaker at age 16.
That's why there's all the scar tissue.
The cuts and the scarring that occurs after being operated on all that time, you end up causing problems with the electrical impulses that cross your heart and allow it to beat.
I get dizzy and my chest hurts really bad, and I just feel sleepy.
Anesthesia is general, that means completely asleep. We're watching you all the time. We'll be watching you like a hawk.
It's scary for you to get chest pain. It's scary for you to not know if you're going to live through the next episode that you have.
My life's day to day.
Back further.
Posterior wall.
It's called atrial flutter. What that is a type of abnormal fast heart rhythm where electrical impulses are traveling around the atrium basically in a large circle or in a large loop. I'm George Van Heer. I am the Director of Pediatric Cardiology here at St. Louis Children's Hospital and Washington University School of Medicine. And I'm one of the pediatric electrophysiologists.
My name is Jennifer Silva. I am the Director of Electrophysiology at St. Louis Children's Hospital. Electrophysiology is the study of the electrical system of the heart.
They're going to go up through my groin and into my heart and burn the scar tissue that's there.
I'll see you inside.
Catheter ablation works very, very well. It's a type of heart catheterization where we place catheters through the blood vessels into the heart. We map the abnormal pathways in the heart, and then we cure the heart problem.
So the plan's going to be to go up there, picture, map, find the flutter, and ablate the flutter.
What we did today was really to map out the atrium very, very carefully. We use a system that does what we call electroanatomic mapping. That means that we were able to construct on a computer a three-dimensional model of the shape and size of the right atrium.
We induced her tachycardia, and then using the map that we had, intelligently thought about where this tachycardia could be originating from.
The map then displays the electrical activity superimposed on the anatomy. And it sort of gives us a roadmap. And so then we can say, well, there's the interstate that we need to basically put a roadblock in.
We would go to it, pace, make sure that was in fact the location that we were looking for, and then started making the ablation lines. Can you live with a heart rate of 70?
For patients who have had extensive surgery on the atrium, which our patient this morning had, they are about the most complex things that we see.
What we've done here is we've actually mapped out the areas of scar, and those are the areas in gray.
Procedures of this complexity really require two electrophysiologists to be in the room to work through them. One person with a catheter in their hand, the other person making measurements, doing pacing, and studying the map.
That we do as many of these ablations that we do is what makes us more and more successful.
In the United States, there are probably around 50 centers that take care of children with heart disease and do catheter ablation. Of those centers, I would say the distinct minority have the level of staffing that we have here in terms of advanced practice nursing, multiple pediatric electrophysiologists, pediatric cardiac anesthesia, and a committed pediatric catheterization laboratory that allows us to really focus on children.
I think today was at least successful for the moment. This may not be something that lasts her in 10 years, but I think she's going to acutely feel better.
Just for her to come out feeling better, knowing that she's going to feel better.
But she did well enough that if all's well here, we're going to let her go home today. That I was able to help her now with this acute event is just incredibly gratifying, because I know she will be better. I know she will wake up and in a few days want to go back to school. And that feels pretty good.
I just want to get it fixed so I can have a life.